Tish, are you ready?
Will, are you ready?
All
We're
right.
ready.
Sounds good. All right, calling the meeting to order at 7 o'clock. Has there been a declaration of public notice?
There has.
All right, order of business. Are there any public appearances today? Okay, doesn't appear to be any. All right, can I have a motion for the consent agenda?
I move approval of the consent agenda as presented.
Second.
Those in favor? Roll
Aye.
call vote.
Aye. Oh,
Sorry, I'm sorry, let me do a roll call vote. Susan Manning,
Aye.
Andrew,
Aye.
Eric,
Aye.
Susan Fox,
Aye.
Peter,
aye.
Maureen, ayes have it. Motion is carried. All right, next are recognitions. Dan.
Hey, congratulations to Silver Connection, our MG show choir, who were the grand champions last weekend for their first competition. They also took the award for best visuals, best band, and were the only school performing fully masked. And there's a link to a group photo. In December, the Monona Police Department added a new police canine to their team and gave Winnequa students the opportunity to help name him. The Monona Police Department narrowed it down to 2 names, and the students voted on the final name for him, Jocko. And again, there is a link to a news article about this story. The Model UN team participated in 2 competitions in December, one in which 50 students competed in one of the most prestigious Midwest conferences, and one where 42 delegates participated locally at the McFarland Man 12 conference, where they took home 24 awards. Again, a link to some additional information and photos. GDS students got creative as they participated in a winter-themed door decorating contest organized by the Student Council. Each advisory worked together to put together a theme that included a winter pun or joke and the name of their teacher. And likewise, again, a link to some photos. And lastly, the Urban League of Greater Madison annually celebrates the achievements of outstanding young men and women across Dane County in honor of Dr. Martin Luther King Jr. Student nominations are based on academic performance, community service, and extracurricular participation. This year, we'd like to congratulate the 2022 Monona Grove High School recipients of the MLK Outstanding Young Person Award: Karina Pedrasine, Cadence Jackson, Layla Faki, Kalea Daniels, Xavier Faison, Zawadi Ozulamo, Adrian Roach, and Anthony Thomas. Again, congratulations to all.
Congratulations again to those students. Correspondence and announcements.
We do, for announcements this evening, just want to recognize that we have in our spring election 2 candidates that will be on the ballot for the position of school board, and 2 of our incumbents, Peter Sobel and Susan Manning. And the election date is April 5th.
Great. All right, next are the administrative reports. Dan?
Okay, and before I begin, you received a note. We were scheduled to have our Winnequa team with us this evening on our next school report. We did postpone that just due to some absences to give a little bit more time. And so that will be coming. We'll reschedule those here soon. We'll let you know the new schedule. Okay, so tonight I would like to give an update on our operating plan and what's happened since the last time that we've met with regard to our COVID protocols, and there's been quite a bit happening. And also very pleased that we have a guest with us this evening, Dr. Greg Demury from UW Pediatrics, and I have the pleasure of working with Greg. He joins us weekly on our Dane County Superintendent calls. He's also very involved with the public health mass in Dane County as an advisor. And so we'll go through a little bit of the things that we're doing in our school district, but he'll be available to answer questions as well that you may have specifically, and not only in our district, but our community and larger with regard to what is happening right now with the COVID protocols. And so I'll just refer to some of the information that I had shared with you. We did today update our school operating plan to reflect the latest guidance from the CDC, which has also been adopted by DHS and Public Health Madison Dane County. So there's a link to that updated operating plan. A communication went out to all families this afternoon with some information about that plan and the current status in our school, and reminders to our parents about symptom checking and so on. And because it is a lot of information, I also share with you an update from Public Health Madison Dane County and shared a number of their links to all the documents. And you'll see that they're not all updated yet. It's a lot to get through and to try to take all the CDC information and to put it into links that will help us, locally with regard to our management. So a lot of information there, and instead of going through all the details, I said I think it will be better just to have a dialogue and see what questions you have and what types of things that you might want to talk about. The last thing on the information shared with you, I listed the number of teacher absences over the last week and a half, and the numbers reflect the teachers in which we need full-time substitutes for homeroom teachers, regular classroom teachers. Of course, we have a lot of other support personnel and specialists that are just as important that we don't always have substitutes, and their availability is very important as well. But you can see from the numbers that we had, pretty regular an increase, substantially throughout last week. And then it has steadied so far these first 3 days. And we have been, everyone has really it's been a real team effort of working together and to be able to manage our classes and keep our schools open. And so I want to make sure that I mention that tonight as well, how great everyone in our staff, teachers, support staff, together working together for the benefit of our students. So why don't I just pause right there and before I guess I turn it over to questions. Of course, we always have Krista Foster takes a huge role here in leading our health services team. As well, I had the opportunity to meet, be part of their weekly meeting yesterday. Maybe that's the other thing, Krista, we might want to update the board just on the role that those folks play. So if you have a few words, perhaps.
Sure. Yeah. We've talked about our health team several times over the course of the last year and a half. And their job has never been more demanding than it has been these past few weeks. So, you may have some questions, but just know we have a team of our 2 nurses. We do have 5 health assistants. We've been down a few folks the last couple of weeks. So we have some amazing substitutes we're lucky to have that have been giving us every available hour they have, as well as our staff continuing to put in, go way above and beyond to respond to. We've asked our families to communicate with us if they have cases, if they have close contacts, if they have symptoms, and they are communicating with us, which is wonderful. Our health team, we continue to get back to everyone as quickly as we can, and we'll talk tonight about sort of our prioritization and making sure that folks are getting the most updated protocols. We did shift in practice as soon as the first update from public health came out on December 30th. As many of you know, and you may have some questions for Dr. Demmer, it was kind of a moving target last week with some of the how the guidance should play out. We're pretty solid on that now. And so they're navigating not only, a 10-fold plus increase in cases, but changes in guidance, kids back in school, and they're doing it with grace and more patience than I could imagine. And so I really appreciate Dan meeting with us this week. And we had a long problem-solving session yesterday and came to, I think, some ways of sustaining this effort, which, is currently pretty challenging. So yeah, just basically just a thanks to them, appreciation for them, their days. And of course, I can help them out. Our team helps out in different ways. They're also in buildings where kids are getting, sick or having normal health room visits and things like that too. So that's what's going on in that realm.
So again, we could probably talk, for an hour about all the things that are happening, but I think more importantly, let's use the time on the things that you would like to specifically, talk about as well as questions. And before I guess we open it up to board questions, I'll give you an opportunity, Dr. Demiri, if again, I know there's a lot that is going on, but I don't know if there's anything, that you would perhaps want to share with our board members before we open up for questions.
Sure, be happy to. And Krista, nice to meet you. Dan and I have worked together on the Friday superintendent's meetings, and you guys have a great program there. And I'm happy to kibitz here and provide a little bit of information if I can. Krista, you nailed it on the head when you said a moving target, and I feel like I wake up every morning and it's just everything is different and changing, and keeping up is really a big part of the game. And it's difficult and can be frustrating at times too. I think there's a sense of frustration from healthcare workers. We like certainty. We like some type of firm guideline that's going to stay for a while. But unfortunately, the virus kind of calls the shots in this realm. So I'm happy to answer questions about like the changing targets that have come up and changing guidelines and recommendations. Some of them make sense. Some of them don't make sense even to me, but I'm happy to provide information if I can.
Dan, is it open for questions now?
I'm sorry. Yeah, thank you. So, yeah, why don't we move on to questions?
Okay, Susan Manning.
Okay, so first of all, I have a question for Krista and Dan, and then I have two for Dr. Demiri. Do you want to just publicly give us an update on your tracking, what you're having to do with tracking? And that's because of staffing, correct? Is that, Dan, didn't we get a note?
So we're talking about specifically, what our health team, as far as contact tracing, and yeah. So our priority, of course, is the communication and notification with families of students who have tested positive, and then the normal process of trying to contact trace of individuals that they may have been in close contact with is where it's become quite overwhelming as far as just the sheer time and volume to do that. And so one of the things that we talked about at length yesterday, and again as a follow-up today, is that we know that that all the mitigation strategies together are important, right? The masking, the distancing, and the vaccinations. And the distancing is the one thing that is a big criteria with regard to whether someone is a close contact, and how do you possibly monitor that throughout the day. So actually, instead of Krista, maybe I should defer to you. You deal with this much more closely on a daily basis. And
yeah, absolutely. And I can add a little context too. I will say this was a really hard decision for our team to come to. They have been doing what I keep calling it like the gold standard of contact tracing. Like, when we were averaging 9 cases a week, their days were full and busy, and making sure that every single person, like talking to every single teacher and student in contact, and really making sure that anyone who could have possibly been a close contact has been communicated with one way or another and received their version of the protocol. We had like I said, we met for a long time yesterday and talked about how do you make an unmanageable demand manageable. And I will say that there's some dissonance around this, right? Because certainly the team has been doing this and has done a great job, and we've really been proud of like the lack of spread in our classrooms. But the truth is, it's related to what we just talked about with the change from 10 days to 5 days as well. We're sort of in this endless cycle of test results are delayed. contact tracing is backtracking and thinking about when students were in class and infectious. And so the amount of work for each case is the same, but we're also not all like, we're not always catching or having the right timeline to be able to do the contact tracing as effectively as we were before. And I will say, we're trying to message us as best we can. This team wants to do whatever they have the capacity to do within a reasonable workday, they are doing. So when we have known information, we're responding to that. It's just from a 20-step process, like how do you streamline that so that it is sort of what Dan said, like triaging, making sure folks who have the protocol, who have positive cases, making sure we're focusing on our mitigation strategies and distancing while we can. And then also really making sure that folks are doing that symptom checking and monitoring and have our communication from a data standpoint, so that they can understand what the environment is within our schools. And what Dan was alluding to or trying to get to, I think, was that idea of when we're contact tracing, we were so confident in our mitigation, we were tracing. And, if we had to err on the side of like, well, that maybe was like 12 minutes, probably not 15. We had good information. We went with that and that was working. Up until December 22nd, we had a routine. It was working. We felt very confident in our contact tracing. We're now in a situation where I think those few minutes matter. That attention to detail needs to be higher. The chances that someone could get missed in a contact trace and still be a close contact is higher. So we're just trying to balance and effectively communicate what really is possible to do, quite frankly, as well as just helping our families and our students and our staff understand the importance of the other mitigation strategies right now, because it is truthfully, the prevalence is unlike anything we've ever seen. And it's a hard adjustment for those of us who haven't been, breathing this 24/7. It feels different to, for example, get multiple classroom notifications in a week. I don't know that that's ever happened in any of our classrooms where they've been notified of more than a single case in a week. So I'll pause there and see, Susan, if you had any other clarifying questions on that.
No, I think that's incredibly helpful to hear. And I think we understand it. Those, again, who of us who have some involvement with healthcare totally understand the stress that you're all dealing with. And again, at some point, if there's a point where you could use volunteers, there may be people in the community that have some experiences, like volunteers for the Red Cross, that might be able to help. So again, I think so many people do want to help, but they're all stressed and struggling like you are. And then I have two questions for Dr. Jamiri. What is your position on continuing the mask mandate in schools after the February? Right now, Dane County has set a February 6th deadline. And it's my understanding from some of the individuals we know, Sue Erickson and Bob Golden, are trying to keep masks on in school. Do you have a recommendation, even a personal recommendation for us in terms of the need for masks in the in-person school setting?
Sure, I do. I think masks are essential right now, and I don't see that changing after the early February deadline of the Dane County mask mandate. We don't know what they're going to do, if they're going to renew or not, of course, but the CDC is firm in its guidance to schools in that masks are essential part of COVID control. And with the current basically surge of cases that we're seeing right now, I can't see that changing in the next 30 to 60 days, if not till, maybe things will look a little better in March or April, and we could have that discussion, but I think at this point, masks are still essential.
And then do you feel that we need to, at some point as a district, try and provide a mask that is considered safer than another type of mask?
That is Yeah, that's a great question. And, it's been a lot in the news a lot lately. And we're expecting a kind of a change in policy today from CDC. And Rochelle Walensky, the head of the CDC, said that CDC is basically not going to change their recommendation, but they're going to provide further guidance on mask wearing for Americans. And it's a little bit of a complicated issue. The kind of operative words have been a tight-fitting mask or well-fitting mask. And a big part of that is we have kind of all seen the masks that kind of pouch around the side of your face and allow air to escape. And remember, the purpose of wearing a mask is not to protect the wearer, but to protect the people that they are in contact with. And Omicron, being much more contagious, can escape those little pouches that come out in our cloth masks, or even some of us in healthcare are wearing those surgical masks. So there's more interest in getting a mask that fits tightly around the side of the face and kind of keeps those virus particles in and keeps the droplets in. And so there's been emphasis on N95s and KN95s. N95s are, they're NIOSH approved. They're very tight fitting. KN95s are mostly made in China and have a little bit of a different standard. I think we'll probably see in the next day or two a little bit more information about this. The key here is, though, it's most important to wear the mask that you can wear and wear continuously throughout the day. So the most important mask is one that fits you well and is comfortable. You see a lot of people tugging at their mask, pulling it down because it doesn't fit well. So it's a little bit of a pragmatic solution. If a cloth mask is the mask that a child will wear throughout the school day, that's the best mask for them. If they can't keep a KN95 on, then that's not going to be the best mask. I trialed a KN95 today. One of our infection control practitioners gave it to me, and it just kept coming off on me. It just wasn't comfortable. It's better for me in that situation to wear a surgical mask. I think it's probably would be beneficial if an alternative, or a variety of masks are made available, particularly to staff. And I think there's some interest now in providing, say, KN95s. That's a consideration. That's something I'd think about. They still are getting still a little bit expensive, and supply is a bit of an issue, though I think that will lighten up here. I heard that the White House is going to make more masks available for schools in particular, and so that would be an option as well.
Susan, would you mind if I follow that question up real quick? Because
no, not at all. In fact, I'm done, and I really appreciate the time that.
Dr. Demiri, thank you very much for being here. Appreciate the time. Regarding the masks, I myself looked at Target, Costco, Walgreens, Walmart, Amazon. There are no masks out there for children. They don't exist. I'm specifically talking about elementary school kids. They're very, very, very difficult to find. And if you do find them, they're very, very expensive. And I know, Dan, you said that we should be getting some K95 masks. I'm wondering if there is a timeline on that, and I'll come back to that question. But Dr. Demiri, am I correct in understanding that even if families and students have a cloth mask, if it fits and the children are comfortable with it and they're wearing it and it's staying on, that is a good option, a good safe option, as opposed to not having one, or having one that doesn't fit right or comes off?
Yeah, that's 100% right. Even if it's cloth, that is better than nothing. I'm really not a fan of those gaiters. That's kind of the last, the bottom of the barrel in terms of masks. The ones that pull up over the face. But those are usually very thin, and I think probably the least most acceptable option. But from there up, I think the hierarchy is basically cloth mask, surgical masks, KN95 and N95. If any of you worn an N95 for any prolonged period of time, it's very uncomfortable. After a while, they're kind of suffocating. KN95s, you're absolutely right. I don't think you're going to find them in childhood sizes. That may change because I think we're starting to see a little bit more interest in a more robust fitting mask. But I can't imagine a 5-year-old doing well in a KN95 with the tight straps that it has. So for those kids, absolutely a cloth mask is sufficient.
And then just your professional opinion of, since we're in Dane County, our precautions are a little bit more significant. Districts like Waukesha, Appleton on the 18th is lifting the mask mandate. I don't know if they're still going to do that, but Johnson Creek is another. There are still a number of districts in the state that don't have mask mandates. And I haven't really looked at the numbers, nor do I think I know them as well as you do. Is there a significant difference with the amount of cases that we're seeing in schools that don't have a mask compared to schools that do, if we have that data?
Yeah, we do. So I work with the ABC Science Collaborative, which is a consortium of mostly pediatric infectious disease practitioners who advise schools, and they're based out of Duke University in North Carolina. And we've got data now on about 50 or 60 schools, and districts, actually, a lot more schools, and data on districts who have had mask mandates versus those who don't. And we track the number of cases, the spread within the school. And spread within school isn't actually all that common. Most infections occur from the home, from contacts with family members, household contacts, friends and family that you're having contact with. But our data from the ABC Science Collaborative is really showing about twice the rate of transmission within the school from those districts who do not have a mandatory mask policy. So masks do work. They do work in schools. And again, I would recommend them.
Thank you. I'm going to pause in case anybody else has questions, and I'll come back, Lorene, if there's nobody does.
I have a question, Krista, in regards to the mask. I know that we've received some emails to students to kind of have reminders about wearing masks. How are things going in regards to that overall?
Yeah, and Dan or Katie, our principals weighed in on this just before break, and then after. I can think of several examples. I do think the reminders have been helpful, especially as people have maybe had a close call or an experience where they are talking to their children. We're reminding families for those days 6 through 10, like giving extra reminders about the importance of mask wearing. I think where we were, before break, I think it's important to acknowledge where we are with fatigue and exhaustion and mask wearing and for different reasons. But, from upper elementary on up through high school, yeah, I think it was an issue that we needed to address, and we're trying to prior to now when we really need to address it. So I think families are reading the messages. I think they're talking to their children. I think children want to be in school, but yeah, it's an interesting time for this surge to happen. Given how folks have been feeling and what they've been dealing with for a long time. So our teams, I think, are on it. They're being as vigilant as they can, being as supportive, especially the younger students, as they can, but yet making sure that it's happening. But yeah, to be completely honest, it did come on the heels of a period of time where we're noticing a lot of exhaustion with the mask wearing.
And then how are you dealing with it? So if students are not wearing their masks or not following the protocols, what are the procedures to deal with that?
Yeah, I can take that. So, it's age appropriate, right? So a lot of teaching and reteaching, in particular with our youngest, learners and for the most part, we know our youngest, elementary students are great, listeners and rule followers. And so it's just reinforcing those. And then, sometimes things can get a little bit more challenging, with some of our older students, but it's no different than all of our other behaviors, that we try to deal with in a positive, proactive way. And so it does not jump right to, punitive measures as communication with parents, of students. So, to just add a little bit to what Krista mentioned, I think we've always felt that the protocols are really important, and we've never, ever had a message that they weren't. But I think, yeah, perhaps it wasn't reinforced as often, before break. And there is kind of a renewed sense of urgency now. And everyone has responded very positively. As much as hard as this is for teachers to continue to have to remind and so on, everyone understands the importance. And so our principals as well have really made sure that it's been a top priority to continue this communication and support our teachers and working with those students.
Peter?
Thank you, Dr. DeMurray, for coming today. And I would like to know what sort of situations you think that you are planning for that might change the circumstances of our operations. What have you been thinking about? What are the factors that might appear that we don't know then, and how might they require us to affect our operations?
Sure, this is my crystal ball question.
Exactly.
Yeah, and it's.
I mean,
it's
if A happens, what do we do? What do we do? If B happens, what do we do? Or what are the circumstances which will let us get back to normal? What are the circumstances which are going to require us to go back to virtual, sort of thing?
So I'll give you the kind of global version first. And I've been wrong about COVID about 3 times now during the pandemic. So take this for what it's worth, because
only 3 seems not too bad.
It's not too bad, right? We all, there were many times we all thought we were out of the woods, and then another variant popped up. So I think kind of worst case scenario is another variant pops up after this, and this just continues time after time without a better vaccine, a universal vaccine, a variant vaccine, that kind of thing. I don't really foresee that happening. I think immunologically, what we know about most viruses, most respiratory viruses, is that this will burn itself out after a while. It will likely be here with us for the rest of our lives at some lower level, but much more controllable level, where it's more part of everyday life. And we won't be masking, but we'll be testing. We'll have some exclusion criteria for schools, that kind of thing. That's the kind of global thing. I think best case scenario from that is Omicron really kind of whips through the population. We develop some population immunity. That combined with vaccination, we're in good shape at least through the summer. I can't say much about next school year. On a more kind of micro level, I think the big thing is staffing, right? The best thing is to have kids in school. We know that's best for their mental health. It's best for their education. Some of the time away from school has been disastrous for kids. We've seen, serious mental health issues, increasing eating disorders and depression. You've probably all heard this before. And so we want to keep kids, in the classroom as much as possible. But the hard part is the staffing. And this is where, when you talk about operations, I think the biggest challenges are going to be. I've heard about districts. I just heard that Minneapolis school district is closing for 2 weeks completely due to staffing issues. And I think that's where your biggest challenges are going to be. And the biggest administrative challenges are really going to be those staffing issues. I was on a call with Madison Metro School District today, and staffing their health offices is becoming very challenging. And it's difficult to have a school open without their health office open. And they have a lot of, diabetic patients and patients with special needs and healthcare needs, and keeping those kids safe and getting their medication, those kinds of things was very challenging when they don't have the school nurses to be able to do that.
Why don't they have the school nurses?
They're out for COVID. They're ill. They're exposed. They're ill. And I on a personal level, 10 out of our 40 pediatric residents are out with COVID this week. And, we're having trouble in the hospital staffing as well. So it's affecting everybody.
Are we seeing primarily Omicron now here locally, or is it still Delta?
Yeah, I heard today nationally from CDC that it was well over 95% of what we're seeing is Omicron. And I haven't heard any recent Dane County data, but it was tending in that direction as well. Yeah.
Okay. Thank you. And I don't want to say that I re-looked at the numbers again. You know, you compare the overall fatality rates from COVID or death rates from COVID in Dane County versus the rest of Wisconsin, and you discover that our efforts in Dane County, which are more, more cautious than the rest of the state, has saved at least, just statistically, at least 630 lives in the county, and in our communities, it's at least 20 lives. So I don't want us to forget that the good work that they're doing is saving lives in our community, in our county.
I think that's a really good perspective on this, is that, every person that puts on a mask could potentially be saving another life. And, most of those are the elderly, honestly, but a fair amount of younger people as well. And, we've been fortunate. We haven't had a lot of children dying from COVID, but we have children in the hospital right now as we speak with complications of COVID.
Elizabeth?
And
Thank you.
could you just add to Peter's kind of that question? I think that's helpful for the community to hear, and that is the increase in the pediatric cases over the last 2 or 3 weeks.
Yeah, there's been a real, rather massive increase in pediatric cases, childhood hospitalizations, and complications since Omicron has hit. I got to tell you, though, Delta was no picnic either, and we started seeing the increase in our hospital in November, and it's I'd say been steady since November at American Family Children's Hospital. We are fortunate here, as you just mentioned, that we're in Dane County and, somewhat in a bubble of protection because of that. And most of the severe cases I have seen have been from outside of Dane County, and most have been unimmunized.
Thank you. Elizabeth?
Yeah, thank you again for being here and these really great responses. I have 2 questions, one for you, Dr. Demiri, and then a question/comment for you, Dan and Krista. Kind of on the same track around our youngest learners, and particularly those who aren't eligible for vaccinations. We've gotten, some comments from parents and families around, here's my young child clustered in groups with other young children that aren't able to be vaccinated. At what point do we think about like the mitigating risk of what you talk about in terms of, closing schools, versus the health risk of COVID? And I'm just curious what your perspective is on that, particularly for our youngest learners that aren't eligible for vaccination.
Yeah. Sure. I think right now, even as we speak, that the benefits of being in school outweigh the risks. And as you get younger and younger, the risk of severe disease gets less and less. And I gotta say that the most significant severe cases that have been in our ICUs have been ages 11 and up, where they're eligible for vaccines. So I think you can still reassure parents that going to school, sending their kids to school, even if they're unimmunized, is still a good thing. Of course, if they're eligible for vaccine, we really want to encourage vaccine. But this comes up with daycare too, right? We've seen a lot of daycares closed in the county due to staff issues, due to COVID in children, and that's a dilemma that a lot of parents face. Do I keep my job and send my kid to daycare, or find alternative measures? And really, like that 0 to 5 year age it's pretty good. The complication rate is pretty low at that point.
Great, thank you. That's really helpful. And yes, my 4-year-old has been with me for the last several days because her daycare classroom is closed because of COVID exposure. So, and I knew it too, right? You get the exposure notices and you can literally just watch the walls closing in and you're like, one day it's going to be mine. I have to tell you, your comments around masking are the clearest and most practical explanation of masking that I've heard through the entirety of the pandemic. And I work for a national public health nonprofit, so I hear about it a lot. And so my question is, Dan and Krista, and you know where I'm going with this because I'm like been on this family engagement kick for a while, the extent to which we can sort of capture that, you know, practicality and sort of guidance. And in addition to the other communications we've been sending out to families around mitigation measures, symptom checking, all of those kinds of things, really great, but kind of sort of those standards around masking, I think might be really useful and helpful. And so curious to hear your thoughts and perspectives on kind of reinforcing to families exactly what was stated, right? Like kind of here's the gradient of effective to sort of less effective masks, but at the end of the day, it's about the intersection of effectiveness and like what your child will tolerate for the longest period of time. I was just like, wow, if I could have put you on a CDC podium, I would have.
Oh, thank you.
Yeah, it's super helpful. And it's funny, like that's the literal, I think we've heard Dr. Amir before, or when our nurse who's been with us the longest time even sent an email to our team today with, you know, again, so Elizabeth, we're going to have the opportunity to communicate about this, right? Because despite all of our communications today, and a lot had to go in that, the next hot topic this week is masking, right? So we are thinking that through. We're talking with our like exactly that, right? Like how many can we get? How safe are they? Are teachers going to be able to teach in them? Are kids going to be able to wear them during the day? But our nurse, you know, Lynn, our nurse, said an email to our team today saying, basically, here are my thoughts. The best mask is the one the kids are going to actually wear. And let's just see what kind of options we can get. And allow our families to understand the best choices available, and then to do on our part, like to subsidize those best choices as best we can with our offerings. You know, we have surgical style masks available, not respirator style, but the surgical style. We have the cloth masks. We have different options, but it is a communication piece because, as we talked earlier, it just has to be worn, right? And we've got to help one another and to get through that. And so we are fielding some questions about that, understandably, and trying to think about our best communication moving forward with masking.
What I like about you, Krista, frame everything as an opportunity. We'll get plenty of opportunity to shore up our correspondences around masks. Last thing around masks really quick. So we talked about the KN95s, but I also know that, the KF94s, the ones from Korea, get talked about a little bit too. They tend to be a little cheaper. I think they're easier to find too. So I'm just curious if like your perspective on that mask versus the KN95, or if they're about equivalent.
Yeah, they are. I think I would put them parallel to the KN95. They just fit a little better, and that's kind of the advantage of the KN95 is that tighter fit around the sides of the face in particular. And most of that has to do with the elasticity of the bands that hold it on. And so I think, from that standpoint, I'd put them fairly parallel. I haven't seen them too much, really, and they haven't come up in our hospital setting at all yet.
That's the one. It's a little bit of a self-serving, selfish question because that's the one my first grader wears, because that was the one that we could find that we were feeling pretty confident wasn't like a counterfeit one, because there's a bunch of like fake KN95s floating around there. For what it's worth, families that are listening, he wears it all day and has yet to complain about it. So
that's awesome. That again, any mask that they'll wear is better than none. So.
Eric?
Does anybody, Susan or Andrew, do you have any questions before I ask one?
No, I was just, while you were talking, I was just Googling KN95 masks for kids, and USA Today had an article that lists a bunch of sites, and it lists the one Elizabeth just mentioned and other ones. So they are out there, but you probably aren't necessarily going to find them in stores around here. You probably have to look online and find them, but they show a few that, as Dr. DeMary, you just said, are better than some of what was being worn, and kids like them. They come with decals and different prints, different colors, but they have that little bit better fit. And then there are some adult or ones that aren't necessarily made for kids, but are petite sizes. So it does take some looking. And yeah, as far as I think the original question was, is the school going to be able to provide any of that? I don't know how realistic that is in terms of quantities, but maybe doing a little more research and sending something home for parents, or here's some options you might want to check out, could be helpful.
Important to remember, Susan, and this is from someone who's been looking diligently for the last 3 weeks. Yes, if you go to Amazon, you'll see the mask, but then look at when they'll be shipped to you, and it will be March or April or June. So even if it's available, the timing of when you would get that could be really messed up. So.
And the other recommendation that I'm seeing a lot, because I've been looking at them for adults too, is to not necessarily order them from Amazon, to go straight to the companies, because then you're sure you're getting what they say you're getting. Because there is that issue with counterfeiting, but that's always difficult too. Anyway, it's just, they're out there hard to find, just like the test.
You know what I sincerely appreciate, and it's interesting when University of Iowa and University of Wisconsin totally agree on a particular point, because that's moderately unusual. But that is one of the most important things, is to have students back in school, because that's where they're safest, and they need to be masked. And the thought about, it's more important to have them in a mask they will wear that's comfortable. And I think about my 4-year-old granddaughter, and she'll put it on and wear it all day long, because they've become acclimated to that. So again, the comments that we got tonight have been so incredibly helpful and supportive, I think, in the work that Krista and Dan have been doing. I think that's really important for all of us to understand, and I appreciate that greatly.
Well, and that is the advice that's coming from Dr. Walensky too, and the CDC. I mean, they are on that same page of, the mask that you will wear is the mask that you should wear. So I think that, that might be a good, I think somebody a while back said, maybe send that message home. I think that might be a good message if parents are still battling, trying to get the best mask. And yeah.
So I have another question for you, Dr. Demiri, and I think this is a really important one, not only because I've read as much as I can, but I'm not a doctor, so I don't understand it probably like you do. Can you give a brief overview? How is Omicron spread? So is it spread by droplets? Is it airborne? And if somebody has a mask on, and let's say they're asymptomatic and they have it, is there a distance that's safe? How does all that kind of play into the safety precautions that we're using and eliminating the risks as much as we can?
Sure. So it's a little bit of a complex issue. And I think the best terminology to refer to COVID in general is that it's what's called an opportunistic airborne virus. It becomes airborne in certain situations. But I think for the garden variety, that transmission that occurs, you can think of it as mainly droplet spread. And I don't think there's difference between Omicron and Delta in terms of the size of the droplet that infects us, the floatability in the air, that you will. It seems that the air is actually cleared fairly quickly of Omicron. The big difference in its contagiousness is its ability to attach to human cells quicker. And the virus has these spike proteins that are little grabbers, if you will, and that's what attaches to our nose and our throat. And the stickiness of that spike protein in Omicron is dramatically more than Delta, than the Alpha variant, and that's the reason for the increased contagiousness.
Okay, thank you. I have another question about the 5-day, the new 5-day quarantine and asymptomatic people. Would you say, is it fairly likely that we have asymptomatic people who don't know they're infected in the schools right now? We just will never know because they might not have been a close contact, but people are walking around and they could very well be asymptomatic. And if they haven't had a test, there's no way that we would know that. Are those people able to spread the virus still, just like someone that would be symptomatic?
Yes, just like with the other variants, it's absolutely true. Asymptomatic people can and do spread the virus, unfortunately. And, many people don't know they're infectious, or they're infectious a couple days before the symptoms start. So that's a big problem and a big reason why we have so much spread of Omicron right now.
And then I have one last question. And I don't say this lightly, but with the virus this significant, it almost seems, it seems hopeless after 2 years that we're ever going to get over it. Can you give us some glimmer of hope that, in fact, these do think, that we're going to get through this at some time? Because I know people are very, very frustrated, and I'm an educator myself in my other job. So it's just really, it's challenging to understand it. And sometimes I just throw my hands up and say, well, we're all just going to get it eventually. So, what can we really do about it?
Yeah, I think fatalism is kind of dangerous, right? I'm an optimist when it comes to this virus. We made it this far. Look at this. We made it this far. Yes, we've had a lot of deaths, but we're moving forward. We're adapting, and we've been able to face every challenge the virus has thrown at us. So I am optimistic. I do think it will. Things will get better. And, in the history of human civilization, that's been the case with every major infectious disease, from the medieval plagues to the 1918 influenza outbreak to HIV. We've adjusted, we've adapted, we've moved on, and we've adjusted our society accordingly. So, as an ID doc, I have the utmost optimism that we'll get through this.
Well, thank you again for your time. I really appreciate it. And I know the other board members do too.
Absolutely. Susan Fox?
Actually, I just have one more comment kind of based on that comment, because I think a lot of people are feeling that way. And I had just read an article about, well, aren't we all just going to get it? And the point was that if you can stave it off now, for one thing, it helps our healthcare workers who are being crushed by this. And to hear that, 10 out of 40 pediatric docs are out, that's pretty serious. So the point of this article was, you don't want to get it now, even if you might eventually get it. The more you can put it off, the closer we may be to a better vaccine that might attack more variants. There might be more availability of the pill that can help treat you. So yeah, you absolutely do want to follow all the protocols now. And I think that's an important message for anybody in the community who's watching too, that that's why the mask mandate is so important to maintain. And that's why following all these protocols is so important, even though we're all tired of it. It just, you don't want it right now.
I can't emphasize that enough. There are new developments coming, and so much has been put into the science behind this. The 2 pills that are out, they're actually on the market now. They're just in really short supply right now, but in a few months, those could be a huge game changer, particularly for those who are immunocompromised or vulnerable, elderly, high-risk patients. They could be a complete game changer. And so you're right, putting this off is good. Don't go out and get infected. I've heard of people saying, oh, I'm just going to go, like have chicken pox parties in the old days. Let's go have a COVID party. You don't want to do that, right? You really want to put this off as long as you can.
Andrew?
I don't have any questions. Everybody asked the question, but Dr. DeMera, thank you for coming. I just have a statement for the job that I do, and I travel around Dane County to different schools. Dan, Krista, Lisa, administration team, the teachers, the staff, even our subs, we're so shorthanded. I want to thank you guys for doing the best you can with what you got. And for all the community members out there, thank you for trying your best to keep safe in your neighborhood, in the community, doing what is needed with your kids. And for the ones who don't believe in all of this, it is what it is. I know that this is going to be here. It's going to be here a while. And the mask that we wear right now It's nothing compared to the mask I wore in the military out in Saudi Arabia. So you guys are lucky for that one. But again, for the schools that I've visited, our school district is, to me, grade A. When I come in and surprise visit and see kids wearing their masks, doing what they're supposed to do, and everyone is trying to do the best they can in education and stuff. So thank you all.
Yes, and I think the other board members echo that as well. Thank you, Andrew. I have a question, Krista, in regards to mental health, right? We kind of touched lightly about that, but overall, how are our students doing? And then also our social service staff, how are they managing, that as well?
Well, certainly appreciate you asking that because, we talk a lot about our teachers who are in classrooms and I think we have a whole team of folks who's doing who everyone's job has been impacted and is different, right? The mental health demand, the support needs for our students and our staff members continue to be significant for sure. Our staff are grateful to be able to be in the biggest complaint last year was it was so hard to not have the walk-in opportunities, the connection in the hallway, the ability to see and talk to the students they were worried about. So everybody, as hard as this is, they're committed to having that contact with our students. It is different, right? And I think the realization we're having as a team is it's going to be different for a while. So we need to rethink, like we all are. We're talking about streamlining our health team response and that role and making it like prioritizing and manageable and a job that people can show up and do and have that impact on students. From a student services and mental health and wellness standpoint, we need to do the same thing. And that number one priority, any one of them who are here today would say the mental health and well-being of our students is the most important part of their job. So that they're triaging as well and spending their time with students, responding to families, supporting teachers in classrooms. We have team members doing things that they never thought would be part of their jobs, but it's what it means to make a team effort right now. So it is helping our youngest students get their hands washed and be safe and be that person they can chat with or talk to. We're doing our best, right? So we were ready to pick up our 7th and 9th grade screener. We had a couple technical issues and now we've got kids out all over, right? So every element of what we're doing is we are going to do the best. We're going to serve the students in front of us every day. And we're going to be responsive to the need in front of us today. And that's not how we're a very, as we all like in this group is, I know too, like we are planful, we are strategic, we have outcomes and objectives we're trying to meet on our teams. We're really just shifting every day and being responsive to if a building is down 6 teachers, that person's job is different. And the needs of they know which students need extra support that day because who can handle these transitions and who can't. So that's a long answer. We're doing okay. Kind of like what Andrew's like, we are doing I am proud of how well our teachers, our principals have been amazing. Like it is truthfully a celebration of how well things are going, all things considered. So I think our role is trying to keep the chaos away from the students and have them be able to learn and be engaged with their classmates and have their, grow socially and emotionally while they're here. And that continues to be the priority. We'll have to talk, right, like long-term about what this means for all of our support roles and what elements of our jobs need to continue and be reinforced. And, those are longer-term conversations. We're in a let's get through this crisis mode with the current COVID situation, but it is giving us a lot of opportunity to reflect on and think about our priorities and how we make decisions around staffing and supports and time allocation and all those sorts of things. Our students are letting us know what they need in lots of different ways through their behavior, their choices, and also just, their ability to communicate.
Thank you. That was really appreciated to give an insight of what's happening. On the lines of that, staff morale, and then just how that's going. And then Dan, you mentioned that staff, sometimes they're having to sub and so forth. Are they still getting breaks and so forth?
Yeah, so I'll answer that one first. So obviously we're trying to be creative on how we utilize the subbing and what's reasonable. And so the goal is, instead of adding on, doing something different, so that there is still as much time as we can, to what's reasonable during the day, so I think that part so far is being managed, very well, by our principals and staff. And it's not just the principals, right? Their whole teams help them put that staffing plan together every day. They work together on that. As far as how the staff is doing, I have not had a chance to visit every school this week. I did have an opportunity to talk to a couple high school teachers today after the school day. And that was one of the questions I asked, how is the staff doing? What is the morale? Are they hanging in there? And I got a very positive response. And so I think, the challenge is going to be the longer that this surge, kind of lasts. If it's shorter than longer, that will, make things a lot easier. If it drags on, we're going to have to continue to adjust. We can't just keep doing the same thing, for a long period of time. We're going to have to make some adjustments. So, but so far as I guess, to speak for the week and a half since we've returned from break, all things considered, yeah, everyone has stepped up and it's gone really, really well.
Thank you. Elizabeth?
Thanks for those questions, Lorraine. I appreciated them. I appreciate the answers too. Back to you, Dr. Demiri, for a second. Can we talk a little bit about testing and the role testing plays in our mitigation strategies, assuming that we get to a place where rapid tests are more rapidly available, if you will?
Sure. Testing is really changing quickly too. The White House has shown a lot of interest in it. I think, its utility, first of all, the most important thing is to have the availability of symptomatic testing. So when a student or staff member has symptoms, they can get access to a test and get results in a timely manner, which usually means 24 to 48 hours. It needs to be a timely manner so it's actionable, and they don't miss school, they don't miss work. That is easier said than done right now. As you are probably aware, testing availability in Dane County is stressed, and some people are waiting up to a week to get a test, depending on where they're trying to get it from. The rapid test is a great test, particularly for symptomatic individuals, but it is becoming quite rare right now. We've been using it in a research project I'm doing on COVID in kids, and we were just informed from the manufacturer, Abbott, that makes the ID Now test, the most popular one, that it's going to be about 4 to 6 weeks before the supply is kind of back online. So I wouldn't hold your breath for rapid testing now. So that means a reliance on PCR. I'm not quite sure what Monona Grove does for testing. Are you utilizing any of the state programs for PCR testing at all?
Yeah, fortunately, we did luck out with our timing there. We have a partner and we're offering PCR testing 3 days a week. And it's been a real blessing for us because it's one of the only places you can come in and get a test and not have to wait hours, or if you can get an appointment. The turnaround it has the same challenges as PCR only. I have reached out to our vendor. We've talked several times about rapid testing, but what you just described, they know we're interested. There's no supply to draw from at the moment. So, but we are currently just doing PCR testing for our student, staff, and families.
That's fantastic. It's great you have that resource, and keep that going. It's a great resource for families. The other role that testing is playing is in the newer guidelines that Krista mentioned earlier, and I'm sure you're really familiar with them. They allow for a test after 5 days to return earlier, either if you're symptomatic or if you're exposed. And so that's a real advantage in getting people who would normally need to be quarantined, particularly your staff. If you can get them that test on day 5, they can get back sooner.
I don't think there are any more questions. Right. Well, thank you both, Dr. Demiri and Krista, for your feedback. This is tremendous for us. And then I think also our families as well. So thank you for taking the time out tonight.
Yep.
And giving us this great feedback.
Thank you.
My pleasure. Nice to see you all.
Right.
Hey,
Next, oh,
Lorraine,
you have a question?
yeah, I do. And I wanted to wait till after the doctor was done because this is much more an administrative thing for Dan.
Sure.
Dan, I just wanted to ask about with subbing and the classes, are the principals and other administrators taking on some of the extra roles of substituting when they can in our district?
When they can, and as you imagine, part of the challenge is the same thing with our student services staff, right? About being accessible for students and other things. So that, it's not reasonable for a principal to sub all day long. But yeah, they absolutely are stepping in. Our district office team as well, as much as they're available, everyone is on call. Absolutely.
Good. I'm glad to hear that. I assume that was the case, but it's that's what every district needs to be doing right now. So.
I was on call last week, Monday, because I was off, but no one called me.
All right.
Okay.
We can move on to board reports. First is Personnel Committee, Susan Fox.
All right. The Personnel Committee met on January 4, and on your agenda tonight, you'll see the results of that meeting. Items J1 through 3 deal with the collective bargaining agreement with the Mgea educational assistants. We were able to reach a tentative agreement at that meeting. It has since been ratified by the educational assistants, so we'll be dealing with that tonight. And I will say more, we can say more about that when we get to it. I hope you all had time to look at the documents related to them as well. And we don't have another meeting set up at this point, so we're waiting a while to see. It's ready to start talking salaries for the next year. So as soon as those CPI comes out, that'll be our next task. Well, and there was one more item too, in addition to that, which was regarding adding a date for notification for retirement. That's also on the agenda for tonight, item J4. So you'll see that as well. Hopefully you've already looked at it. That's it.
Thank you, Susan. Next is the Ad Hoc Sustainability Committee. Peter?
Thank you. The Ad Hoc Sustainability Committee met last Thursday, the 6th. A couple of items on the agenda. First of all, the high school solar projects. We have an updated schedule. They plan to start the actual installation of solar panels on the 28th of February, weather permitting, of course. And if, again, weather permitting, everything goes well, they plan to turn this, they'll be able to power up the solar system on around the 15th of May, with sort of final completion midsummer. After all the review and the the final analysis of the system. So, but it does look like it will be up and generating power from the middle of May on, starting through the summer where we get the most power generation. The committee is looking at planning some sort of an event, some sort of a ribbon cutting event that we would target for the middle of May, which would be a significant achievement. Again, this is the largest solar array on a K-12 in Wisconsin, and it's the first one that's sort of designed at the right financial scale to have the biggest impact on the district's finances and our energy usage. It's sort of aimed at the target of what schools should be doing to maximize their dollars, maximize what they can do to limit greenhouse gas emissions. In addition, the committee considered and actually moved a recommendation to the board of a sustainability policy. Susan sat in on the meeting, and the policy should, and I think She's seen it go to the policy committee for consideration and review before it comes to the board. I think that's the appropriate path of action. Now, this is something I talked about 1 or 2 meetings ago, that we wanted to move forward on this. And so that's in the process, and it will come to the board again, after policy has had a look at it. And if policy has any really concerns, they can bring it back to the sustainability committee. But we want to move forward with that policy and that change. And our next meeting will be, what is it, Thursday the 19th. That's the right date. Yeah, the 20th.
Okay, thank you, Peter. Next is the policy committee. Susan Manning?
So the policy committee met on December 21st. And basically the policy that we reviewed was 5113 full-time public school open enrollment. And after review and discussion, this policy was approved by the committee and will be coming forward for its first reading. So we will be discussing that policy tonight. And most of the language is clarification, and it did come from administration. And we appreciated the help and support that they provided on that policy. You can also see in our minutes that we have like another 15 plus policies to review, which we'll continue to work on, as well as a sustainability policy. And we have added the sustainability policy to our next meeting. And by that time, we want to make sure we have some other resources. And again, Peter's committee has done a nice job of reviewing this material and the language. I was able to sit in on the meeting and hear them discuss their language and some of the rationale for the language being used on that policy. So we'll be bringing that forward to you soon after that meeting.
Okay, next is the Monona Grove Education Foundation. Susan Manning?
Yes, so I attended the meeting on January 11th at 4 p.m. They didn't get done till like 5:30. They have some very interesting things happening in the foundation right now. Dan gave a report, and again, he presented just a very nice, thorough update to the foundation board about working through the pandemic, trying to stay in person, working with teachers, very much like the discussion we had tonight. Under new business, Gordy McChesney, a previous high school principal and a great friend to the community, resigned from his emeritus status per his own personal request. Part of it just is time and time frames and things like that. So the foundation board wants to thank Mr. McChesney for his contributions of time and funding to the foundation. He continues to fund a student scholarship in his name. So as a school district, we are very, very appreciative of everything that he's provided to us. Then there was a discussion and possible motion to approve establishment of a Glenn Mcnaughton teaching scholarship. So the family came forward, Mr. McNaughton's wife came forward wanting to set up a scholarship in Mr. McNaughton's name. And to her pleasant surprise, their son, Mr. McNaughton's son, actually offered a matching gift to their contribution, which doubled the contribution. The other thing was, in the discussion, it was clear that they're very much like the Patty McGinnis and Annie and Herden scholarships. There may be some community members that would very much like to contribute to this scholarship. Our family benefited greatly from his instruction. So again, knowing there are lots of others out there, they're going to work on establishing a method for donation as well. There is also a donation from the estate of Mary Jean Lavick. Her husband was the basketball coach at Monona Grove and involved in the teaching here. And they have requested that the criteria include a connection to Monona Grove basketball. There was also some discussion relating to information that the donation includes a donation to the Monona Grove High School Athletic Department. I'm guessing at some point Dan will bring that forward. Is that correct, Dan? Is that?
Yeah, if once we have that, that'll be on the agenda for approval.
Okay. The foundation also discussed the possible formation of a subcommittee to work on these scholarships. So again, that will be coming out of the board. And they approved scholarships for spring 2022 as submitted. There are currently 2 open board seats on the foundation. So if there's some interest, I of course had to suggest Rhoda McKinney because she was so great on that strategic plan. So anyway, there's lots of names that are out there. If people are interested and would like to come forward, the foundation would be very much like to hear from you. There was no other report from the communications committee, the fundraising committee, or the grant awards committee. There was approval of a grant from the grant contribution to the foundation to Mgea 21, and their outline is just excellent in the work that they plan to do. And as that starts to be formed, I'll bring you more information about how that project is going to go forward. Their next meeting date is February 8th at 4 p.m. And again, they're working very hard on trying to provide scholarship and funding to our students in a great variety of ways. They have a committee that's been going out and meeting with the teachers and administration in the different schools to try and identify needs for the foundation.
Thank you, Susan. All right, next are possible action items. First one is 2021-2022 collective bargaining agreement with Mgea educational assistants.
And I don't know, Dan, if you want to say something about this or.
Sure, I'd be glad to. So this is really straightforward. As we know, the base wage of 1.23% is the maximum that can be bargained through the collective bargaining. And so this is just the first portion of the overall compensation. And so we're asking for approval on the document. If the dollar amounts represent a 1.23% for every individual in the bargaining unit.
Susan, I move approval of the 2021-2022 collective bargaining agreement with Mgea and the educational assistants.
I'll second that.
Any further discussion? Roll call vote. Susan Manning,
Aye.
Peter,
Aye.
Elizabeth.
Aye.
Susan Fox,
Aye.
Andrew,
Aye.
Eric,
Aye.
Lorraine, aye. Ayes have it, motion is carried. Right, next is the 2021-2022 educational assistance supplemental pay.
And
Peter?
so,
I'd move approval of 2021-2022 EA supplemental pay as presented.
second,
Any further discussion? All right, roll call vote. Susan Manning,
Aye.
Peter,
Aye.
Elizabeth.
Aye.
Susan Fox,
aye.
Andrew,
Aye.
Eric,
Aye.
Lorraine, aye. Ayes have it, motion is carried. All right, next is the revised educational assistance compensation plan. Peter,
I'd move approval of the revised EA compensation plan as presented.
Second.
any further discussion? Peter,
I would just ask Dan or Jared or somebody to lay out the differences, the changes.
To explain the difference in this new plan, you mean?
That's right. The revisions.
Right.
Sure.
And the
I'll be
revision
glad to.
was- Yeah, the
Are you-
document for the revision was shown in the previous item, but I
Right.
think, yeah.
So, items 2 and 3 kind of go together. But 2 is the actual wages that include some of the folks are not on the schedule. That's why it's a separate document from the schedule. But the bottom line is that the existing schedule recommending eliminating the first 3 steps with the sole purpose of trying to increase the starting wages for each of those positions. We've lagged behind, inflation's rising, there's a labor shortage, and so we've actually done this for all of our employee groups, but the same holds true for our educational assistants. So that's the major change in this plan is eliminating 3 steps, which really then increases the starting wages.
And I would just note that we're facing market forces that require us, if we want to hire people to fulfill the needs of our students, we do have to find ways to be competitive with the other jobs that they're out there on the market. People get into education, they don't do it for the money, but we do need to be competitive. We do need to be able to give them a wage where they will be able to provide what they need and for their families, and at least justify that they love doing this, and they're doing this because they love it, but they can't we can't ask them to sacrifice their families when they do that. So we have to pay competitive wages with the market that's out there. And that means making adjustments as we've had to do this year. And yes, it's a costly endeavor at times, but the fact is that we have to provide services.
Susan?
So Peter, I just want to understand, again, understanding that we keep getting this kind of group in the middle. You're on the committee.
Mm-hmm.
You support this, correct?
Oh yeah, absolutely.
Okay. In its current structure.
Yes.
Okay.
Right. Doesn't appear to be any other questions, so we can go ahead to roll call vote. Peter Sobel,
Aye.
Elizabeth?
Aye.
Susan Fox?
Andrew?
Aye.
Eric?
Aye.
Susan Manning?
Aye.
Maureen? Aye. Ayes have it. Motion is carried. All right, next is the teacher retirement plan revision. Andrew?
I move approval of the teacher retirement plan revision as presented.
I'll second that. Oh, Elizabeth can say.
Thanks, Peter.
All right, any further discussion? Susan Fox?
I just want to add a comment for anybody that might be listening. It's not clear. This is not a major revision. It's simply, it's in the public printed comment, but that under the old collective bargaining agreement, we required potential retirees to notify the district by March 1st, I guess. Yeah, March 1st of a given year. And when Act 10 did away with that agreement and we created a handbook and set up, and then in a few years set up the new retirement plan, we neglected to put any language in there. And it really hasn't been an issue till recently. And partly because of COVID, we've had just a couple of requests off from that with very good reasons. And the board would still have the ability to grant someone a retirement if something came up after March where they all of a sudden felt they needed to retire and explained it. We would still have the ability to approve that. But this puts out the general expectation without that kind of mitigating factor, that we do expect people to notify us by March 4th. And part of that, March 1st, sorry. Part of that is, again, due to the increasing competition for finding people and just the advance notice for Jared with his budgeting, because particularly that tier 2 part, that has a budget impact, and we just have to be able to plan ahead. So it makes sense. And the Mgea was fine with it, so there weren't any objections. So that's the only change. It's not a change in the plan itself. It's just the notification.
Okay, there are no questions, so we can do a roll call vote. Peter Sobel,
Aye.
Elizabeth.
Aye.
Susan Fox,
Aye.
Andrew,
Aye.
Eric,
Aye.
Susan Manning,
Aye.
Lorraine, aye. Ayes have it. Motion is carried. Next is the 2022-2023 school calendar.
Yeah, I can say a couple words before you move into possible action. So there is a memo attached. I think that's pretty self-explanatory about the calendar. It's very close to kind of a status quo, but there were a couple adjustments, and the adjustments were made based completely from teacher feedback on based upon how this year's calendar has gone. And the two major changes, one was the kind of the timing of our fall break and the desire to match that up with a vacation day towards the end of October. And then secondly, the concept of a floating half day, a professional day. And this idea came because 2 years ago, when we started the year virtually, and as we're trying to kick off the year, we actually did that concept with some in-service time in August. And it went over really well. And we were having some challenges in this year's calendar because of where the dates fell, in order to try to finish always, that second week in June and not have to go into the, third week. We were coming up short a day. And so this was something that we know that our teachers are putting extra time in August in preparation anyway, but the concept having credit for a half day at their discretion, even though it shows it on August 26th, it really can be done anytime, during that August, and teachers can choose, in that preparation. So I think a creative way that's really a positive thing, give a little bit of flexibility for our teachers. And so those are the major changes in this year's calendar.
A motion, Andrew,
I move approval of the 2022-2023 school calendar as presented.
Second.
any further discussion? All right, roll call vote. Peter Sobel,
Aye.
Elizabeth.
Aye.
Susan Fox,
Aye.
Andrew,
Aye.
Eric,
Aye.
Susan Manning,
Aye.
Lorraine, aye. Ayes have it. Motion is carried. Next is the Girls Hockey Cooperative Team Sponsorship Agreement with Stoughton, Oregon, McFarland, Evansville, Deerfield, Lodi, and Parkview High Schools for 2022, 2023, and 2023 and 2024. Susan Fox.
I move approval of the WIAA Girls Hockey Cooperative Agreement with Stoughton, Oregon, McFarland, Evansville, Lodi, and Parkview High Schools for 2022 and 2023, and 2023 to 2024.
Second.
Okay, any further discussion? Eric?
I just have a question. Is there a big shortage of women hockey players? Is that why we have to?
Yes.
Is it, I mean, how bad is it?
Oh, it's like sometimes one.
Yeah.
Not even
So
one. Yeah.
the history of this co-op, for many, many years, it was 4 schools. Stoughton, Oregon, McFarland, and Monona Grove. And then Evansville, Lodi, and Parkview in more recent years have added on. Many of those schools have only 1 player or maybe 2.
Okay. Yeah. We need more women hockey players.
They don't come out.
Olivia, you're playing hockey next year.
Yeah, guess what?
Oh, wait,
I have, hey, we've got 3 down here on the islands and probably more than that who are going to be standing up there playing. We have a she's a high schooler right now that lives over off of Mesa. That is a spectacular player and makes the newspaper every week. Again, I've got 3 grandchildren you guys are going to have to come watch because they're also quite good.
And we should mention that
Women.
an Olympic hockey player came out of this program. So, right?
Thing.
Out of this
Yes, he better.
cooperative team.
Well, my 4-year-old's doing learn to skate, so we're just playing the long game here. In 10 years, Eric.
All right, we can move to vote. Peter,
Aye.
Elizabeth,
Aye.
Susan Fox,
Aye.
Andrew,
Aye.
Eric,
Aye.
Susan Manning,
Aye.
Lorraine, aye. Ayes have it, motion is carried. All right, next are discussion items. First is the policy revisions, first reading.
Okay, as Susan Manning mentioned in her report, this policy revision is mostly, procedural and provides clarification. Where it really started was as Jared, is the primary person that helps coordinate our open enrollment program and his staff. And then as we get alternative applications throughout the year, as a reminder, there's the normal open enrollment process that parents apply for. They'll be coming up and we'll be talking about here in the next item. But then there's also an alternative application that parents can submit anytime during the school year. And the question had come up, does our exception that we have in our policy where we automatically allow siblings to enroll of students who are already in, does that apply to alternative open enrollment applications? The DPI guidance wasn't real clear. Our policy certainly wasn't clear on that. And so we worked with our legal counsel. They worked with DPI to get a clarification on it. And then they recommended some this language that's being presented to help clarify our policy. So again, it's not a change in practice. We already have it in our policy that siblings of students already currently attending automatically get a seat when they apply, but this language in the policy helps make that more clear. So then as we're utilizing the policy, we understand what the rules are in implementing it.
Okay. Doesn't appear to be any questions regarding that. All right. Next is the 2022-2023 open enrollment recommendations.
All right. So as Dan had mentioned, we are approaching our regular open enrollment process or period. So annually that runs from the beginning of February through the end of April. And I think we're going on year 4 or 5 that it's been extended for that many months. Before it was only a three and a half week process. Now it's opened at the beginning of February and goes through April 29th. So when we talk about regular open enrollment, it gives families the opportunity to apply. It all goes into an application portal. Once the deadline for the process ends, then we start working through the applications. And it truly is it's not a first come, first serve. It's literally, we take all the applications based on the number of spots that we have available, and it's a random drawing based on each grade level. We have to randomly draw which grade that we apply open enrollment applications to first. Obviously, as the previous discussion on the policy, we do automatically accept siblings. So if there is no space in a regular classroom, we still do accept those. And so what we're looking at tonight is just to give you a preliminary idea of what we're thinking. By law, the board has to set their initial number of open enrollment available seats in regular education by the end of January. We can come back and modify it in the concept of adding seats. We cannot take seats away, which makes it challenging, especially during COVID and trying to figure out, what is enrollment going to look like in the third Friday. So within the admin content, I did put together a working document so you can see how we're rolling our students forward. playing with different sections, allowing for some residential growth. And when you look at how we come about the recommendation, the board actually at the end of the month approves it at a grade level. You do not approve it at a building specific. And then we work through that. So for example, 4K is in both communities. And right now our preliminary recommendation is 47. That is in line with what we've typically done. For example, last year we were unlimited. And we actually received 49 applicants and actually 29 ended up coming. The year before that, we started out in January with 25, and then we've always made modifications. And so as we continue to track this, we figured that we're comfortable for the most part with 4K. So we might as well, instead of making it a low recommendation and knowing that we're coming back, let's make that initial recommendation up front. So, and we follow the board policy and guidelines when it comes to class size. So the board has a policy and guidelines around a class size goal. And so that's what we shoot for. So we take the number of sections that we are currently planning for, multiply that by the board goal for each class, and that gives us a total. And then we subtract out what we believe is our enrollment going to be. And that available spot, the difference there is the amount that we accept for open enrollment, or we ask for approval for open enrollment. The amount that we're asking for tonight is pretty much in line what we've typically asked over the last 5 to 6 years. I know it might seem like it's a large number, but when we look at multiple grade levels across the district, and it's not just specifically, so when we're looking at 6th grade, you know, we technically have 2 6th grade programs. We have GDS and we have MG21. When we're looking at 1st grade, we have Winnequa and we also have Cottage Grove School. None of the recommendations here are necessarily creating sections. We don't open up new sections and fill them with 100% with open enrollment. What our goal is to actually make fill the classes up, so we're not necessarily having to necessarily reduce staff, and it allows us to have more balanced classes throughout. We as a district, when someone does apply, they do have the ability to be specific of where they would like to be placed, but at the end of the day, the district has 100% responsibility of placing that. So if we draw someone and they've said they would like to go to Winnequa and we don't have any spots at Winnequa, we would definitely offer them a spot, either Taylor Prairie or Cottage Grove or Granite Ridge. And then the parents have the ability to choose that. So, and every year, you know, we typically receive about 225 to 250 applicants on an annual basis. And then when we do the final approval at the end of the month, there will be special education, and special education is not added on top of this. It just tells us, working with Krista's team, she's able to identify based on the number of seats that we've said that we can take within regular open enrollment, how many of those could actually be served with caseloads. And so she goes through a pretty extensive process to identify that. One thing that will be a little different this year, it won't be specifically by grade level. It will be over, you know, bands of grades and caseloads, because obviously our case managers don't necessarily work within one grade level, and especially if it's a specific disability that might not be very specific to one grade. So our case managers might be working. So we want to ensure that we're following the letter of the law and also our board policy to the fullest extent. So tonight is just the preliminary, and then we'll continue to modify our numbers, have conversations specifically with Mitch at the high school, and we continue to monitor that. We obviously are monitoring the different housing developments that are coming in. Obviously, some of those are still early in the planning stages. Some of those are still early in the construction stages. And, you know, and you don't always get a perfect report that says that, you know, this subdivision is going to specifically bring in 5 first graders or, you know, 2. So we do build in, when we're rolling kids forward and doing our projections so early, we do what I consider adding a significant amount of residents to ensure that we have growth for them to come into each of our classes, because we know that we can always come back and modify or increase our open enrollment numbers. Any questions?
Elizabeth?
Thanks, Chair. Just a quick clarification, and I'm pretty sure you said this, but I just want to make sure I'm understanding. So for the grade levels where we have no proposed seats, it's because based on your projections for next school year, we would be at or close to the board policy guidelines on class size?
We would be at or close to being over the class size goal.
Okay,
Yeah.
thank you.
Mhm.
Susan Fox?
Olivia.
I have to do it at least once a meeting. Forget to unmute. You may have said this as well, but don't we have to give formal approval of these numbers? And if so, that'll be in the next January meeting, or do we not have in
Yes,
January?
Yep, you do have to do formal approval, and so that will come at the next board meeting in January.
Thanks.
Peter?
I believe that there was one case in the past where we actually increased class size, number of classes to accommodate open enrollment students. We took a shot at it. And how did that work out?
So I can tell you that was, I believe that was 12 years ago.
It was
We did open up a kindergarten section here in Monona for those students.
Yeah.
I can't specifically speak to how that worked because I think they are potentially seniors now. But I know that was something.
Gone, I think. Yeah.
But I
and
can't
we
speak
only
specifically.
the reason we were able to do that was because we had space in the building and because we
Right.
did look ahead and had room. At this point, I don't see
No,
us.
I understand all that, but my question is, in the long term, how did that work out? And if we have presented with a similar situation based on our past experience, would it be worth moving forward doing that?
I mean, I think if we look at the overall enrollment and if we had space, so for example, we bring in over $3 million in open enrollment revenue. We don't do that necessarily for revenue purposes, but it definitely benefits the district. If we know that we have, that we can meet our class size goals without having sections being added. And so like, for example, if you know that you have to run 11 sections of 6th grade, for example, and that's going to bring you in at, say, 21 kids per class. Obviously, yes, smaller class sizes are wonderful, but if this class size goal is 25, if you reduce that section to 10, we're probably going to be at 27 or 28. Now that's pushing the class size. So by keeping that section and accepting open enrolled, you're able to meet your class size goal plus bring in additional revenue, which then benefits the district and our resident students because we're able to continue to keep our class sizes down because we're monitoring that. But we're not adding a section, we're maintaining that section.
I know, I'm just want to look at this history of this and see how it, because I have to add that, at the middle school, but particularly at the high school, having more students is a benefit for all students because it allows us to offer a wider variety of programming, extracurriculars, and most importantly, classes, because we have extra students. When you go from 10 students who are interested in a class to 11, suddenly it makes financial sense to be able to offer that class. And so I want to, look at the big picture. It's always better to have more students, particularly in the upper levels, because it lets us increase the diversity of our programming. And I want to make sure we don't miss any opportunities. So that's just why I'm asking about and I understand this year is what we're working on this year. Okay, that's fine. But I just want to, for the history, going forward, when we look at it, I just want to make sure we take into all these factors into account when we're doing this.
Right. And there are, obviously trends. So we do see that there are certain grade levels where families are willing to apply for open enrollment. Obviously 4K is a big applicant pool. Sometimes entering middle school and definitely at 9th grade. You'll notice that obviously these are still preliminary numbers, but in previous years we've accepted like 25 or 35 freshmen. Right now we're looking at 10 because we do have a fairly large 8th grade class that's transferring up into 9th grade. And then we're looking at that overall space of the high school. So I would agree with you, Peter, is having that ability to offer other additional programming, if that's, something in the trades or world language, because we're able to do that. And a couple of years
Sure.
ago, we've been able to add more sections to our course. So like at one point we were at, 8 sections of English, 8 teachers for English, 8 teachers for social studies. And we were able to slowly increase some of those sections to 9, or core classes to 9 sections, and slowly take some of those open enrollment students, but it wasn't necessarily creating new sections because of open enrollment. Is what it was doing is we were trying to keep our class sizes lower. And now we're at that point. We're just being very conservative at this point because of the growth that we're possibly going to see in Cottage Grove.
I just want to, if I can, Susan, if I just comment for a second, when we looked at this sort of back in 2007, 2008, when we looked at this, we did this study about splitting the district. They looked at class sizes and high school size and so on. And if you looked at the data, there was this really clear indication that below 1,200 students, high school started to sacrifice the complete variety and diversity of programming, complete breadth of programming. And we're a little bit below 1,200 students. And so anything that can get us up sort of to that 1,200 number, I think is a benefit to what we can do in what we can offer, the variety of things that we can offer in our high school. And it had, in addition to sort of academic programming, it had to do with extracurriculars and sports and so on. And if you looked at the schools in Wisconsin, it was like 1,200 was sort of a magic number where you got to offer the full range of everything.
Peter, Susan Fox, and then Susan Manning.
Well, yeah, I was just going to say I agree with that in theory, but I think it's also we just have to always balance that against the physical space we have in our building.
Absolutely,
Number
no
of
question.
teachers we have, and sometimes I know when we added that one kindergarten section, it didn't. I mean, the money that brought in more than paid for the teacher. That it doesn't necessarily compute at the high school if you end up with odd numbers, and because we did have some years where we had just huge class sizes where students literally talked about having to bring a chair from a different room into their room so they could fit. And we certainly don't want that again. So I really appreciate that we already did raise the classroom guidelines for the high school for partly budgetary reasons way back. And I think personally, we still need to be very careful about that as well. So I appreciate all the account. And with the growth that's going on in Cottage Grove, that is a substantial, I mean, there is a concern that the high school will become overly full sooner than we thought. So I think we just have to watch all of that and have the total picture in mind. But yeah, that's a comment when members of the public see larger class size and ask about open enrollment. I always make that same point, Peter, because it is an important point to remember. We do need numbers to be able to offer the variety of curriculum. And if you lose too many, you can't do that. I mean, when I taught at the high school way back when, it was well over 1,100 and it dropped down to I think 648 or something at one point. At 648, it gets pretty tough to offer the same curriculum. So yeah.
And I would note we have our own special limitations because our high school was built with smaller classrooms with the idea of smaller class size than sort of average. And so when we start increasing our class sizes in the high school, not the number of classes, but the class size, individual class size, we do run into trouble at earlier threshold than many schools would run into.
Thank you, Peter. Susan Manning.
One of the things that this board and this district has been incredibly committed to, and that is to each and every student and each and every teacher. And we have studied and studied and studied the positive effect of class guidelines. And we've reviewed those numbers. And the only time that we've dramatically changed those was due to budget constraints where we needed to raise $1 million for expenses for 5 years. And Jared has developed a great system for evaluating the open enrollment numbers and providing those to us. Prior to my years on the board, there was a predisposition to take all open enrollment students that applied, at which time our class size numbers dramatically increased. And you would have a teacher with 35 students in a middle school classroom trying to teach Spanish to students who have never had any experience with this language. So the commitment, I think, particularly during the COVID pandemic, to our teachers in maintaining the class size guidelines under the open enrollment, I think are critically important right now. I think we have to show full support for our teachers and the stress and struggles that they are going through right now, even with the sizes that we have, trying to maintain in person. So I think this is a good discussion, one that we should have, but I think we need to wait until we've moved out of this surge and we can come back in a more healthy, stable environment. And we need to strongly support our teachers during this time period.
Thank you, Susan. All right. There's no further questions. Thank you, Jared. Next is WASB Delegate Assembly Resolutions. Andrew, did you want to share some information?
I've been waiting for this moment all of my life. This is my moment, finally. There are 10 resolutions out there. I think I had mentioned this back in November. If you wanted to look at it, if you had any questions, of course, you can contact the executive director for WASB to get clarification. But if it's anything that you see that you want me to vote yay or nay on, you can just send it to me in an email and let me know. Susan Fox, you're on mute.
You're still on mute. There you go.
I'll just say that it's probably a good thing because I was just expressing frustration. I read through them all. I think they all look worthy of support. So I would personally encourage you to vote for all of them.
Yeah.
So anybody else has it?
Peter, and then
I'm going to apologize. I'm going to apologize right now to my colleagues here on the school board for being a little pedantic right now. I support all of these resolutions, but I only support resolution 2202, which has annual inflationary or greater increases in per pupil spendable resources, because it says inflationary or greater. If you go back 100 years, take the average teacher salary and adjust it for inflation to today, anybody have a guess on what you get? Oh, come on, somebody throw out a guess.
Lower salaries.
Over $1
$1
million.
million.
$15,000.
15.
Adjusted for inflation, you get $15,000. Who thinks we would have a viable school district if our average teacher made $15,000? The problem is that salaries, life in general, the cost increases as gross domestic product, as GDP, which increases faster than inflation. And we all ask for inflation thinking that we've won if we get inflation, but it's not nearly enough. Asking for inflationary increases to school budgets is a formula for strangling Wisconsin public schools to death. Period. End of story. And I went back 100 years. Well, you know what? We are 24 years into a cycle of where we've had less than inflationary increases to Wisconsin school districts. We're 25% of the way to that $15,000 payments for teachers, salaries for teachers. Okay. This resolution should say WASB supports annual increases per pupil spendable resources for public school districts of GDP, gross domestic product per person or greater. Gross domestic product is the minimum. And I apologize for being pedantic and kind of angry about this, because we think when we ask for inflationary increases that we've won, but we're losing at that level. And the debate, we as school board members and we as people who are interested in public education in Wisconsin, the continuation of public education in Wisconsin, need to ask for more. And there's an interesting thing here. If you get to GDP, that tax revenue goes as GDP. So you can do increases to school budgets of GDP and not increase taxes, or tax rates, I should say. So this should not be inflationary or greater. It should be GDP or greater. And I can't overemphasize that enough. And I'm going to suggest that next year, when they ask us for proposals for resolutions, I'm going to ask that this board approve a resolution saying that we expect annual GDP increase or greater increases on per pupil spendable resources. We need to change the debate. The debate since 1997 has been inflation is the right number, and inflation is a losing number.
So
Aren't they all losing numbers, Peter?
Nah, GDP would be right. It would mean that that money for schools expands as the economy does.
Okay. So
And
Peter,
GDP is always greater than inflation.
you want to send that to me in the email, because I can try to amend that Tuesday night.
Really? All right, I will do that.
Yeah, do that for me.
Good
And
idea, Andrew. That would be great.
And I can see what happens from there.
Maybe they won't know, Andrew.
Elizabeth, I think.
Well, I
Elizabeth
mean,
has
Peter
a-
stole my soapbox, so what is there to say now? Just kidding. That was really interesting, Peter. I have nothing of value to say except for I agree with Susan around agreeing with the things, although now I agree with Peter's amendment. So I agree with amendments.
So this is pretty awesome. It's only 10 resolutions. 2 years ago it was 20, and there was a lot of arguments and a lot of fighting going on and yelling and stuff. But at the end, when it was all said and done, we went outside and had milk and cookies. It was great. So I'm looking forward to it. Thanks for your input, everybody.
Right. Thank you, Andrew. All right, next are future meeting dates. Our next meeting date is January 26th and at 7 o'clock. All right, can I have a motion for adjournment?
I move to adjourn.
Second.
All right, all those in favor?
Aye.
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 Right, have a good night, everyone.
Good night.
Aye.
Thanks.
So Lorraine, you're still